right. So, still technique for an upper thoracic. Obviously, one first identifies where there is a somatic dysfunction. And in this case, the setup includes putting the patient's somatic dysfunction into the position of ease. So I will be diagnosing as I am doing my initial setup. I have found that there is a prominent transverse process here of T2 on the right. So I am going to assume that there is right rotation. However, I'm going to motion test to then assess that. So as I rotate the head and side bend the head to the right, things are getting softer. If I extend, it actually increases. So when I flex him forward, this actually improves. So I now have his somatic dysfunction placed into the position of ease. This is a diagnosis of T2 is flexed, rotated right, and side bent right. I'm now going to add in a compression vector through his head and cervical spine down to the level of T2 until I feel softening of the tissues. Once I achieve that, I am then going to introduce left rotation, left side bending, and finishing with extension. It's usually best to finish the technique using or treating the sagittal plane last. And then I'm going to go back and recheck. And moving into flexion, things are easy. Moving into extension, they are also easy, and there is balance between right and left transverse processes. When I test for rotation and side bending to the left, which you could not do previously, I find that those motions are possible.